I'm Dr. Randy Linton, and I'm the president and CEO for Mayo Clinic Health System here in Northwest Wisconsin. I came into healthcare, I'm not sure in a conventional, unconventional way, but I grew up in western Nebraska on a wheat farm, and so there was really no one in my family that had ever been in healthcare. So I always had an interest in primary care. I looked actually initially thinking of even family medicine as a potential area, but I really enjoyed pediatrics, the interaction with not only just the children, with their families. It was a way, I think, to do a primary care, to look at sort of the broader care of an individual, but to be able to narrow that down, so to speak, within that age group of the pediatric age group. Many people have some really strong maybe preconceived ideas exactly what they wanted to do when they start. I didn't have that at all. I just sort of went through, and this seemed right and felt comfortable, and so I made the decision to pursue then a residency training in pediatrics. To be recognized by the Red Cross is really a very honor and something I will always treasure. Sort of to be recognized for things is a bit of a strange experience from the point of view of just sort of doing your job. I've been very fortunate in my career to be able to do a variety of different kinds of things. I've had a career here in Eau Claire in medicine for the past almost 36 years. 20 years of that I was involved in doing full-time pediatrics, and I really thoroughly enjoyed that part of my practice. The interaction with the patients I saw, the kids from birth through college, and their families was always a very important piece of what I've done, to work with the families when things were going very well and sometimes when things were going very bad. And to build that trust with the families is a very important issue. Leadership roles where we have a chance to interact and look at ways to improve healthcare. Truly feel that down deep I always most closely identify myself as a pediatrician, even though I've had a chance to do these other leadership roles. And those experiences and learnings really helped to give me that perspective and background that really makes it much easier to do what I'm doing right now. There's sort of an old saying in some ways when you're a parent and a pediatrician. I always say that being a pediatrician never made me a better father, but being a father always made me a better pediatrician. I've been fortunate to work with a great group of individuals and people, incredibly talented, dedicated individuals for many, many years that make my job now actually very easy. It doesn't matter who you are, what your title it is, no one can do this alone. And the individuals that I've had the opportunity to work with have not only done great care to patient, but also inspired me about how do we do better things, and that dedication is really important for that. Many times it's hard not to be, and many times sort of defined by our job in terms of who we are, but I don't think our current roles or jobs have to totally define who we are as individuals. We have a chance to evolve and to move on to other things as well. So I'm clearly looking forward to those opportunities.